I'm Jennifer, and I'm a hairdresser. I also am a salon owner here in Daphne, Alabama. About 4 years ago, I was in cosmetology school and doing a lot of standing on concrete floors, and one day I felt like I had a stone bruise on the bottom of my foot, and the next day I was limping a little, and the next day I was limping a little more, and then I woke up with so much pain that I couldn't put any weight on it. And that trouble turned into 4 years of pain. It was the kind of pain where you couldn't push through it. I never wanted to stand. I never wanted to walk. Even sitting was painful unless I had it elevated. So it was constant pain, and that just affected every area of my life. It affects your energy level, your attitude. I couldn't do my job. And I was just desperate for relief. I went from being able to stand behind the chair and doing people's cuts and colors to pretty much sitting at the front desk and answering the phone. The doctors tried a lot of different things. X-rays, 2 cortisone shots in my foot. We tried certain prescriptions that were for nerve pain, and nothing worked. Eventually, I was told to go the pain management route, and I had heard from several people how wonderful Dr. Yearwood was.
So with Jennifer, all of the pain was located right there in her heel. She couldn't get away from this pain. It was 24/7. DRG therapy is a way to deliver neurostimulation to a specific area of the human body where someone is having pain. And when I say specific, I mean something that is so focal and so concentrated that you know it's always there, it's always bothering you. With DRG stimulation, I can go in and I can target that specific area of the foot, just that specific area, and knock that out. Give them a life again.
Now I'm back to living life again and not having any pain. Now I have lots of options. I was going to say I fold down the bags, so yeah. It's fun to be able to do those creative projects and have fun and do social things and cake decorating and smiling again.
I love it. I love it.
Getting to the core of the pain and removing that is incredibly rewarding.
Now I'm happy to now be back at work.
Oh my goodness.
The whole thing is amazing. And when this really worked, and it really does, it's wonderful because it just gives you your life back.
These are actual patient stories. The stories are the experience of these individuals only. Although these patients did not experience complications, there can be risks and potential complications associated with the use of medical devices. If you are interested in learning more, please consult your physician. Indications for use. U.S. The Axiom neurostimulator system is indicated for spinal column stimulation via epidural and intraspinal lead access to the dorsal root ganglion as an aid in the management of moderate to severe chronic intractable pain of the lower limbs in adult patients with complex regional pain syndrome, CRPS, types 1 and 2. Study subjects from the ACCURATE clinical study had failed to achieve adequate pain relief from at least 2 prior pharmacologic treatments from at least 2 different drug classes and continued their pharmacologic therapy during the clinical study. Please note that in 1994, a consensus group of pain medicine experts gathered by the International Association for the Study of Pain, IASP, reviewed diagnostic criteria and agreed to rename reflex sympathetic dystrophy, RSD, and Kyphalgia as complex regional pain syndrome, CRPS, types 1 and 2, respectively. CE mark. The spinal modulation neurostimulator system is indicated for the management of chronic intractable pain. Australia. The spinal modulation implantable neurostimulation system is indicated for spinal cord stimulation, SCS, for the management of chronic intractable pain of the trunk and/or limbs. Contraindications. U.S. Patients contraindicated for the Axiom neurostimulator system are those who are unable to operate the system and are poor surgical risks. Patients who failed to receive effective pain relief during trial stimulation are contraindicated to proceed to the INS procedure. CE mark and Australia. Patients contraindicated for the Axiom neurostimulator system are those who have an active implantable medical device including, but not limited to, cardiac pacemakers and cardiac defibrillators, are unable to operate the system, and are poor surgical risks. Potential adverse events. The implantation of a neurostimulation system involves risk. Implant manual must be reviewed for detailed disclosure. Refer to the user's manual for detailed indications, contraindications, warnings, precautions, and potential adverse events. Caution. Federal law, USA, restricts this device to sale, distribution, and use by or on the order of a physician.